invocation today will be given by Monsignor William Manger with St. Anne Catholic Church. Monsignor, if you'd like to come forward, please. Everyone, if you so choose, please stand with me and remain standing for the pledge to our nation's flag.
Lord, you have been here waiting for us to come, and we place our minds and hearts in your presence. As this council comes to consider its business, touch the minds and hearts of the council members who implore your wisdom and love. Lord, we understand that you are perfect, and you have a perfect love for each person you have created and sustained in existence. We are varied in political beliefs, religious beliefs, and cultural origins. Some live in nice dwellings, some on the street, some are incarcerated. Some behave as you wish, and some do not. Your creating hand has placed us all here as your children. We are brothers and sisters, and so we are our brothers' keepers. It is our commercial, recreational, athletic, and artistic activity which benefits many and which may require regulation, particularly if there are serious dangers to the health and welfare of others. Those matters require wise human decisions, which we implore for the council here today. Amen.
Amen. Please join me in the pledge to our nation's flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, Monsignor Manger. May we have the roll call, please?
Mayor Ames.
Here.
Mayor Pro Tem Felshaw.
Present.
Councilmember Getz.
Present.
Councilmember Neal.
Present.
Councilmember Pate, absent. Councilmember Samuel. And Councilmember Mouton, absent.
Thank you. Councilmember Mouton will not be joining us today. She lost her father-in-law, Ed Mouton, I believe is his name. And so our condolences go out to her and her family, so she will not be here. Okay, we do not have any presentations or recognitions today, so we will move right into public comment. Now would be the time for any citizen who wishes to speak on items 1 through 4 or the consent agenda. The time to do so is now. If you would like to speak on one of these items and you haven't already done so, please fill out the green slip, hand it to the officer. She will call, the city clerk will call out your name. We would appreciate if you keep your comments to 3 minutes. The green light will come on when you approach the podium, and the red light will come on when your time is up. If you're to speak on any other item, I will open up the microphone at the end of our general business for that purpose, but right now it's for the consent agenda or items 1 through 4 in our general business. There appears to be no one, so council, entertain a motion on the consent agenda, please.
So moved.
There's a motion for approval on the floor. Is there a second?
Second.
There's a motion and a second. Is there any discussion or questions? Councilmember Neal.
Thank you, Mayor. On C, for the lubricants, I was looking at the evaluation, and on section 2, Midtex was actually the low provider, and they have Tricon highlighted. So I'd like a clarification on that. It's not much money, but there is a difference in both being Beaumont firms.
Yeah. So the bid tab that was given to council was later updated and not included in your packet. I noticed the same thing, Councilman, and the bid by Midtex they didn't bid on every item in that section. So when I updated the bid tab, which I have in my hand, I can give all a copy. I made that note that they didn't bid on every item. That's why they were the lowest and not awarded.
So how did we give them 1, 3, and 5?
They bid all the items in those sections. Each section was scored separately.
Okay, one more question.
Sure.
On section 6,
Mm-hmm.
let's see here. Tricon was within the 5% range, of Apache, who's out of Pasadena. Is there any way we could give it to Tricon since they're a local provider?
Yeah, that's the same thing. That's another update that I made. So, Tricon and Midtex are both Beaumont businesses, but neither are located inside the city limits, and our policy requires to be inside city limits.
All right, thank you.
Sure.
Any other questions or comments from council? All right. There's a motion and a second on the floor. All in favor, please say aye.
Aye.
Opposed? The motion carries unanimously for approval. First item, please.
Good afternoon. Good to see all of you. We haven't
Nice to see
met in
you.
a few weeks. I'd like to take this opportunity to recognize Mayor Ames for her recent appointment to Governor Abbott's task force. It's a task force on disaster issues affecting persons who are elderly and persons with disabilities, and she was sworn in on November the 3rd. She's one of 10 persons that were appointed to this statewide task force. So congratulations to you,
Thank
Mayor.
you. Thank you. Thank you very much.
Mayor and Council, item number 1 is to consider a resolution authorizing the lease of 22 vehicles from Enterprise FM Trust. Back in 2016, the City Council actually approved an equity lease agreement with Enterprise FM Trust. And each year during the budget process, as you know, all fleet vehicles are looked at for mileage, maintenance, repair cost, and priority in providing city services to determine if they need to be replaced. The equity lease is typically for a term of 5 years. At the end of the lease term, the city can either purchase the vehicle for the residual value or can have Enterprise sell the vehicle through an auction whereby the city receives the net proceeds. So 17 vehicles have been identified to be replaced through an equity lease pursuant to this master agreement, and 5 vehicles would be added through the equity lease. The estimated annual payments are provided for from the Capital Reserve Fund, the Solid Waste Fund, the Water Fund, and the Airport Fund. The administration recommends approval.
Thank you. Council, you have heard the reading of item number 1. Is there a motion for this item, please?
So moved to approve.
There's a motion on the floor. Is there a second?
Second.
There's a motion and a second on the floor for approval. Is there any discussion or questions? Appearing to be none. All in favor of the motion, please say aye.
Aye.
Opposed? The motion carries unanimously for approval. Item number 2, please.
Item number 2 is to consider a request for the conveyance and dedication of private streets and infrastructure in the Oak Trace subdivision to the city of Beaumont. In 2017, the city adopted a process for the conversion of private streets and other infrastructure to public ownership and maintenance. At a joint public hearing held on February the 17th, the Planning Commission recommended 7-0 to approve a proposed ratification for the conveyance and dedication of private streets and infrastructure to the city of Beaumont once completed, with the following condition. It states approval of conveyance document by the city council. The conveyance document has now been signed by the association members and the lot owners and is ready for consideration. I'd like to thank Chris Boone and his staff, our legal department, for their work on this, Public Works Department, Water Department. The administration recommends approval.
Thank you, council. You have heard the reading of item number 2. Is there a motion on this item?
So moved for approval.
Thank you. There's a motion on the floor. Is there a second?
Second.
There's a motion and a second on the floor. Is there any discussion?
I have a question, Mayor.
Go ahead, please.
Thank you, Mayor. Mr. Manager, I was looking back through some of these letters, and some of these go back to, I think the earliest I found is May of 2017. Can you explain this process to us?
Yeah, there were a number of private subdivisions built, probably going back beyond the 70s, but for sure in the 70s and 80s, a number of them, which are allowed by, you know, our code of ordinances and state law. So you have these private subdivisions built with private streets and in some cases private infrastructure. In some cases there's like Wood Park, you know, the water and sewer is maintained by the owners. In this case, Oak Trace, the water and sewer's been owned by the city of Beaumont. We've been maintaining that infrastructure. So as, you know, 30 years goes by and your street starts failing and having issues, we had these different homeowners associations start to reach out to us, saying, hey, we want you to, you know, to help us. And long story short, we met with legal and these different groups separately a number of times and came up with this process that we brought to the council in 2017 to say, you know, this is a avenue that, you know, we can take over this infrastructure and be responsible for it. And we told them up front, if the council approves this, you're not going to the front of the line, meaning, you know, there's already a number of priorities, and I'm not saying your street or your water and sewer doesn't need improvements, but it's gonna have to go through the normal process. So they were good with that, and this is the second group, I believe, Chris, that, you know, you're gonna consider this item right now. So this will be the second group, if this is approved, where the city of Beaumont takes over the infrastructure. So I think there's a couple other ones out there that we're working with, and but that's the background.
If I remember correctly, we put that process in place where they have to follow certain guidelines, and there has to be, you know, the right-of-ways and all the different things are in those guidelines, right?
And their homeowners association and owners approve it and make the formal
Right.
request to y'all, and then our different departments go out and look at the infrastructure and know what we're getting into. So we do recommend approval. It's one of those deals, a lot of people go and buy a home and move in and don't know that the street out in front of them is a private street, and they wonder why isn't the city, you know, taking care of this, and there's an explanation, but a lot of people don't know.
Yeah. Yes.
Just curious, is there a situation where we would decline to take over a street, and what would that be? Because I'm noticing here, like the one in Wood Park, I mean, some of these items are expensive to, you know, to make the repairs and maintain this. But what's a situation where we would decline?
Well, we haven't had one yet, but there's probably circumstances where, well, first, I mean, you may have a private street with 2 or 3 houses on it that the public's not, you know, doesn't have good ingress and egress, or the public's not traveling on that roadway. That may be one scenario. Another one, again, the process I think y'all approved back in 2017 is a good one, because the owners have to want this, or the great majority of them do. So, you know, there may be a street that's in such disrepair that the city, number one, is not in a position to make the improvements in a timely manner, and would not want the public or our police, fire, or EMS vehicles maybe on it. I mean, that's another possibility. But so, yeah, I think it's a good process. Again, they have to request it. We're gonna look at the infrastructure and make a recommendation to y'all. The planning commission's making a recommendation. You have the ultimate decision. So it's working so far, but there may be cases where we would not recommend it.
Thank you, Mayor.
Yeah. I will say that when I was first elected to council, I did live in Wood Park, and the homeowners came to me and asked me if I would suggest this. And at that time, we didn't have this process, and there was issues with the right-of-ways. There was a bunch of different issues. So I think we had so many coming, you know, toward us in 17 or whenever we did that we decided to create a policy on it.
That's correct.
Okay. We do have a motion and a second on the floor for approval. All in favor, please say aye.
Aye.
Opposed? The motion carries unanimously. Item number 3, please.
Item number 3, Mayor and Council, is to consider approving a substantial amendment to the Consolidated Grant Program's 2020 Action Plan to include Community Development Block Grant reallocated funds for the Public Facilities and Improvements line item, and consider approving a resolution adopting the amended Consolidated Grant Program's 2020 Action Plan. So the revised budget reflects a reallocated amount of $853,013. These additional funds, they were discussed with you in a work session probably 30 days ago. The additional funds would be used to rehabilitate Bob Street from Sarah to Virginia, Ector Street from Harriet to the south end of Campus Street, and Goliad from College to Washington Boulevard. Again, we went through that with you at a work session here. In addition, the city recently received notice from the Department of Housing and Urban Development that the original CDBG and home allocation amounts were not correct. They were off by a few $100s. So due to the changes to the action plan, the city needs to submit what is called by HUD a substantial amendment to its 2020 CDBG annual action plan to include the aforementioned activity proposed for those CDBG funds. And the administration recommends approval.
Thank you. Council, you have heard the reading of item number 3. Is there a motion on this item, please?
So move.
There's a motion and a second for approval. Is there any discussion? There being none, all in favor, please say aye.
Aye.
Opposed? The motion carries unanimously. Item number 4, please.
Last item today, Mayor and Council, item number 4 is to consider a resolution authorizing a contract, if I'm pronouncing it right, Voya Financial for stop-loss insurance. The city's health insurance plans are self-insured. However, to protect the city from large health claims by any one person, it's recommended that stop-loss coverage be purchased to cover claims that exceed $225,000. So towards the end of each calendar year, our benefits consultant gathers the claims history of that year and solicits quotes from the market and negotiates the most favorable terms for the city. Voya Financial responded with a quote of $1,233,313, which is 8.3%. It's an 8.3% increase over last year's quote. While this is not the lowest bid or lowest quote, it is in the best value when you model for projected claims, given the structure of the deductible options. And if you have any other questions, Todd could answer them. He oversees this. So the funds are available in the Employee Benefits Fund. The administration recommends approval.
Thank you, Council. You have heard the reading of item number 4. Is there a motion, please?
So moved.
Thank you. There's a motion on the floor. Is there a second?
Second.
There's a motion and a second on the floor for approval. Is there any discussion?
Question, Mayor.
Go ahead.
Thank you, Mayor. Mr. Manager, option 3 is a decrease of 19.51%. Option 5 is a decrease of 7%. And option 6 is a decrease of 26.84%. I'm trying to find, I know y'all make the comment that this one y'all proposing is the better option, but I'm not seeing it. I see the specific deductibles and some of the other differences, but I don't see anything major.
Okay.
So I could walk through each one at a time if you want to, but for example, option 3, where there's a savings on the quote. So there's a different deductible for option 3. It's $300,000
Right.
instead of $225,000. So if you have 4 claims or more that are above the $225,000, then you would make up the difference in that premium between option 4 and option 3. Typically, we have anywhere between 5 to 12 large claims a year. So when our consultant takes that into consideration when they're doing their modeling and projections, if you have more than 4 claims a year, then you're paying more under option 3 than you would under option 4.
What about option 5?
Option 5, that's the same thing. So their deductible was $250,000 compared to $225,000. So if you have 7 claims or more, it would eat away that savings. Also, just to let you know, we're probably going to enter into the next year with 5 existing claims right off the bat. So when I told you we usually have between 5 to 12 large claims a year, we're gonna start out next year with probably 5 claims already. And so, given that you go between 5 to 12 more additional, option 4 is gonna be more advantageous than option 5 in that situation.
All right, thank you.
Okay. Any other questions? I do have a motion and a second, don't I? Yes. All in favor, please say aye.
Aye.
Opposed? The motion carries unanimously. And I believe, is that all of our items?
Yes.
That concludes our general business items, and before I go into public comment, I would like to read that at the close of the city council meeting, the council will hold an executive session to consider matters related to contemplated or pending litigation in accordance with section 551.071 of the government code. Elizabeth M. Noble, individually on behalf of all others similarly situated versus City of Beaumont, cause number 1:20-CV-400. Now would be the time for any citizen who wishes to speak. If you would like to make public comment today and you haven't already done so, please fill out the green slip at the rear of the room, hand it to the officer. City clerk will call out your name. We would appreciate if you keep your comments to 3 minutes. The green light will come on when you approach the podium, and the red light will come on when your time is up. Is there anyone who wishes to speak? There's no one that wishes to speak today? Okay, I'll move then to council member comment, and I'll start with you, Councilmember Getz.
No comment.
Councilmember Neal?
Thank you, Mayor. Just like to remind everyone that we will be having a fly-in at the Beaumont Municipal Airport this Saturday from 10 to 4, and this will be a family-friendly event. That's 455 Keith Road. That's all I have.
Okay, thank you.
Thank you, Mayor. Just would remind everyone that the Wall of Heroes is out in the foyer. This is a joint project between Ford Park and One City Cares, which is a ministry, a part of the One City Church here in Beaumont. This is a wall honoring our first responders and our healthcare workers. And this is an opportunity for everyone, the council, employees, and citizens to sign the wall and leave a message just communicating to the first responders and the healthcare workers how much we appreciate them. Micah Fuller with Ford Park is in the back. Amy Everett with One City Cares and One City Church is in the back. And we appreciate this project. This wall will leave here today. So this is your last opportunity to sign it. It will move to the county courthouse and then other locations across the city. There will be a total of 4 walls, I believe, when it's all said and done. And once they're filled, they will all be put together and displayed at Ford Park inside the building for everyone to be able to see. And so let me encourage everyone to go by the wall on your way out. There are markers on the table next to it that you can use. Please use those markers and sign your name and a message to our healthcare workers and our first responders. Thank you, Mayor.
Thank you, Councilmember. Thanks for organizing that. Appreciate it. Councilmember Samuel?
I have nothing, Mayor.
Okay, and Councilmember Mouton, as I mentioned, is out from the death of her father-in-law. I just want to let everyone know, because we did get a few messages. We did have some technical difficulties last week with uploading our code onto the website Wednesday, Thursday, and Friday, but that is now resolved. But it was loaded on our Facebook pages and was sent out to our press release, our press, all of our press. So we did. I'm glad to know people are looking at it. We got quite a few calls that it was not on the website, but it was technical difficulties, and they have that we have gotten it on our website now. I think the thing to look at, and because I do have a lot of calls from the press about COVID-19 and the holidays and all the different things that will be happening, and the second page has a graph, and this is the questions we get asked a lot, and I know there's no way you can see this, but if you go to the website, this is on there, and it basically gives you where we were and where we are now. And as you can see, we have spiked up quite a bit this last month or so, mainly due to so many of the openings. And There will be a press conference tomorrow about the holidays on the steps of the courthouse with several different entities involved, and we'll talk about that a little bit. But a lot, I do also get questions about the hospitalization rate. I do have a really good friend that had COVID for 2 weeks and was taken to the hospital yesterday and had a hard time getting a bed. And so, but I believe that this morning that he has. But I did want to just basically say I did talk with both hospitals, and they say that we have great plans in place to open more beds, so we should not be concerned about the beds. But it's not the number of beds to be concerned about, it's the manpower. ICU beds are basically 1-to-1 nurse-patient ratio, and general beds may be like 5-to-1. So if we have more folks in the ICU, that means more manpower. And if we have to expand the bed count, that also means more manpower. So it's really been a strain on the nurses and doctors, and so I think it's appropriate that we are signing this this information to thank them. The good news is that they say that those who seek treatment early do well and have a high chance of survival. And unfortunately, the virus is so widespread, most patients don't know where they got infected. And we are still doing contact tracing through our health department every day, as we have been. And many times it's very hard to pinpoint where the person got infected. And that's unfortunate, because then they don't know, they can't call everyone else. But the big message from the healthcare providers and the physicians: don't travel for the holidays, stay home, wear your mask, and wash your hands. Practice CDC guidelines, which is what we were talking about earlier. So I did want to bring everyone up to date on that. I think the biggest day that we had in the last week was 56 new cases in a day, which we haven't been at that since probably August, maybe even before then. So just please, everyone, be careful. The more we practice the CDC guidelines, PPE has proven to be effective. In fact, our friend's wife was taking care of him for 2 weeks in the same house, was very adamant about wearing her PPE, and she's tested 4 times negative. So it does help. So please follow those guidelines. And with that said, I just want to clarify so we're all on the same page, because I really wasn't even on the same page either, about council chambers. We can go up to 75%, as I understand it from legal, but we still are supposed to follow the CDC guidelines, and that's why these, so we're all on the same page, these reserved signs are on the chairs. We're supposed to sit in the chairs that say reserved, correct? Not the ones that don't say reserved. So what I'd like to happen, if I don't know if there's anyone from maybe the clerk's office or someone that could, when people are coming in to chambers, just to let them know to please sit in the chairs that say reserved. And then if we fill those up, then we will go to the overflow room, and just to continue to do, to follow the CDC guidelines. And if any council members aren't in favor of that, you need to talk to me, but that's what we're doing for now, because we want to do what's right, so we're all on the same page. So with that, actually, Councilman, I was getting ready to close the meeting. We're through. So if you have something you'd like to share with us, now is the time. Do you have anything today?
No, Mayor.
Okay. All right. So I think that's everything. I haven't missed anything, I don't believe. So we will now recess into executive session. Thank y'all all for coming.